Let's begin with a personal reflection from a physician trained at a major trauma center in Oakland, California. Immersed in the world of conventional medicine, the author found themselves navigating a system that prioritized acute trauma care and emergencies. Yet, beneath the surface, there was a silent tension. The author's background in naturopathy was kept hidden, as mainstream medical professionals often dismissed or even alienated those with alternative perspectives. This experience sharpened the contrast between conventional medicine and homeopathy, setting the stage for a deeper exploration of two fundamentally different paradigms. As we move forward, we'll see how these approaches diverge not just in practice, but in their very philosophy of health and healing. At the heart of the discussion lies a core paradigm shift: conventional medicine versus homeopathy. Conventional medicine, sometimes described as the flat earth view, seeks out common traits among patients and applies standardized treatments aimed at the disease itself. It filters symptoms, focusing only on those necessary for diagnosis, and prescribes uniform medications, often in large, chemically potent doses. In contrast, homeopathy adopts a spherical earth perspective, investigating the unique differences among individuals. Here, every subtle symptom matters: physical, psychological, and contextual. Treatment is highly individualized, using microdoses that act as catalysts for the body's own healing. This approach is designed to avoid side effects, as the remedy matches the patient's entire symptom profile. The result is a philosophy that treats the whole person, not just the disease. Let's delve into how symptoms are conceptualized. In conventional medicine, disease symptoms are the standard clinical signs used to classify and treat illnesses. Think wheezing and shortness of breath in asthma. These criteria help generate diagnoses but often ignore the broader context of the patient's experience. Homeopathy, on the other hand, values patient symptoms that are typically overlooked: environmental triggers, physiological variations, and even emotional states. For example, whether shortness of breath is relieved or worsened by open air, or if a patient craves salty foods versus sweets, all become crucial clues. By integrating these subtle expressions, homeopathy creates a comprehensive therapeutic profile, aiming to treat the organism as a whole rather than just isolated symptoms. A cornerstone of homeopathic pharmacology is the law of similars. Like cures like. Homeopathy recognizes that every substance has a total effect on the body, and the distinction between intended effects and side effects is artificial. Instead, all effects are simply medicinal effects. In practice, a microdose of a substance can cure symptoms in a sick person that mirror those the same substance would cause in a healthy individual at higher doses. These remedies are prepared in minute, non-toxic amounts, designed to gently stimulate the body's natural healing response without forcing or overriding its pathways. This approach stands in stark contrast to conventional drugs, which often produce unwanted side effects due to their potency and targeted action. To illustrate the power of constitutional homeopathic prescribing, consider the case of a 40-year-old woman suffering from anxiety attacks, dry mouth, and bad breath. She neglected to mention her chronic hand dermatitis, believing it to be unrelated. The homeopath selected the remedy graphites based on her overall systemic picture. Remarkably, not only did her anxiety and mouth symptoms improve, but her chronic hand rash also resolved completely. This outcome demonstrates a key principle. When the whole person is treated, healing can occur across multiple systems, even those not directly addressed. Homeopathy seeks to resolve the underlying central disorder, rather than just managing isolated symptoms. In conclusion, the brilliance of homeopathy lies in its holistic philosophy. Health is not merely the absence of disease, It is a dynamic state of balance and vitality. Conventional medicine often focuses on eliminating local pathologies, sometimes leaving the overall constitution weakened or vulnerable to new problems. Homeopathy, however, sees all symptoms as interconnected, viewing the patient as a unified whole. True healing strengthens the vital system, allowing diseases to resolve naturally as health is restored. By addressing the root causes and supporting the body's innate defenses, homeopathy aspires to a deeper, more lasting form of wellness.